is anatomical terminology for healthcare professionals. In clinical practice, there are lots of specific terms related to different parts of the respiratory system. The good news, though, is that they're mostly really straightforward. Let's begin with those related to the upper respiratory tract. The first root we look at has to be nas or naso with the O at the end, which of course means the first point of entry in the respiratory system, the nasal cavity. We'll see it pop up in terms like nasoscope, an instrument used to examine the nasal cavity. Another root that also refers to the nose is rhine or rhino with the O at the end. You've almost definitely heard it used in the term rhinoplasty, perhaps better known as a nose job. Next up is pharynx or pharyngo with the O at the end, referring to the pharynx. The pharynx in itself is divided into three parts. The first and the last of the segments, the nasopharynx and laryngopharynx, are pretty straightforward. The oropharynx is a bit less obvious. However, as soon as you find out the or oro with the O comes from the Latin word oris for mouth, it will make perfect sense that oropharynx is located behind the mouth at the level of the tonsils. The root pharynx or pharyngo with the O at the end also pops up in terms like pharyngocirrhosis, meaning dryness of the pharynx, and pharyngomycosis, which is a fungal infection of the pharynx. Now that concludes the upper respiratory tract, and we move on to the lower tract. Here we have the root larynx or laryngo with the O at the end, which of course relates to the larynx. It's used in terms like laryngalgia or laryngostenosis, which is narrowing of the larynx. Occasionally, you'll come across terms that look like a random jumble of different roots. However, if you break them down, you'll see they're actually quite simple. For example, nasopharyngeal laryngoscope is a flexible endoscope introduced through the nose to examine the pharynx and the larynx. So although it may twist your tongue, it need not to break your spirit. Now that leads us to trachea and the associated root trache or tracheo with the O at the end, such as tracheitis or tracheoplasty. We're now moving into the bronchi, and unsurprisingly, the roots we have here, bronch or broncho with the O at the end, or bronch or bronchi with the I at the end, in addition to bronchiole or bronchiolo with the O at the end, which refers to smaller branches of bronchi, the bronchioles. They all come from the Greek word bronchos for windpipe, and are used in such instances as bronchorrhea, which is excessive secretion of mucus in the bronchi, or bronchiolactasis, which refers to dilation of bronchioles. We're now moving to alveole or alveolo with the O at the end, of course refers to the terminal part of the bronchioles, the alveoli. An example is alveolitis, which is an inflammation of the alveoli. We're in the lungs now, which are, without a doubt, the best part of the whole respiratory system. We have a few roots related to the lungs too, like the Latin-based pulm or pulmo with the O at the end, or pulmon or pulmono with the O at the end, like in intrapulmonary. We also have the root word pneumo or pneumon or pneumono with the O at the end, which comes from the Greek word for lung. For instance, pneumomelanosis is the blackening of lung tissue due to inhalation of inorganic particles such as those from smoking. Pleural or pleuro with the O at the end, of course, refers to the pleura covering the lungs. For instance, one can develop a pleurolith, or calcified nodule within the pleural cavity. And finally, terms related to the respiratory diaphragm often contain the root phren or phreno with the O at the end, such as the phrenic nerve or phrenoplegia. Phren can also refer to conditions of the mind. Of course, you'll also get the more obvious diaphragm or diaphragmo popping up, like in diaphragmatic, which means related to the diaphragm. If we're talking about the respiratory system, we can't avoid talking about breathing, right? There is one mighty root which occurs in terminology related to breathing, and that is spire or spiro, which comes from the Latin word spirare, meaning to breathe. It's where we get the term respiration, in addition to the terms inspiration, the action of breathing in, and expiration, or breathing out. You'll also see the root spire or spiro with the O at the end used in clinical practice in terms like spirometer, which is an instrument used to measure lung function by recording the amount of air inhaled and exhaled out of the lungs. Ventilation also refers to breathing. Perhaps the best known example of it is hyperventilation, abnormally fast and deep breathing. It of course has a counterpart, hypoventilation, which is slow, shallow breathing. We also have inhalation or breathing in, and exhalation or breathing out, united by the Latin origin of their root from the word halare, meaning to breathe. Of course, if there is a Latin word for breathing, we have to have a Greek equivalent, right? I'm talking about the root word pnea, such as eupnea, which describes the state of normal breathing, or apnea, which refers to cessation of breathing, especially during sleep. Of course, we can't forget the other function of the respiratory system, making sound.
Do, re, mi, sol, la.
We have the suffix phonia relating to the voice or sound, such as egophony, which is a word used to describe odd, broken, high-pitched sound similar to that of a goat. So obviously we don't just breathe for nothing. It's all about the exchange of the gases oxygen and carbon dioxide. And we have two word parts here. Ox or oxo with the O at the end, oxy with an I or oxy with a Y, are of course for our beloved oxygen, and they're pretty versatile. Check it out as a prefix in oxyhemoglobin, as a root in hypoxemia, and in hypoxia. For every yin, there is always a yang, and the opposite of oxygen-related terms are those related to carbon dioxide. The suffix kapnia comes from the Greek term for carbon or smoke, and refers to conditions related to the CO2. An example would be akapnia, the absence of carbon dioxide in the blood. A lot of this terminology relates to the cardiovascular system. The gases are carried around the body by blood after all. And don't forget, we have a video dedicated to the cardiovascular system in this series, so go and check it out if you haven't already. Let's move on to our favorite, clinical terminology. That's what we're here for as healthcare professionals after all. Continuing with the theme of blood, we have a couple of conditions for you here. Epistaxis comes from the Greek epistasian and simply means nosebleed. Hemoptysis is a term which means coughing and spitting up blood or bloody sputum from the trachea, bronchi, or lungs, as what may occur with inflammation or cancer of these organs. First is hemothorax, simply meaning blood in the pleural cavity. In contrast, pneumothorax is accumulation of air in the pleural cavity. The pleural cavity refers to the space between the lungs and the chest wall. And moving on, we have some general medical terminology for you. Would you like to have a guess what tussis stands for? Well, it might surprise you, this fun little word stands for a simple cough. You'll see it pop up in words like pertussis, the term for an infection disease commonly known as whooping cough. Bronchus is the abnormal low-pitched rattling sound heard in the lungs due to obstruction of the airways. For example, due to excess secretions. Stridor, on the other hand, is the harsh, high-pitched sound of inhalation or exhalation due to obstructed airways. Atelectasis is the term for partially or fully collapsed lung. Pulmonary edema refers to accumulation of fluid in the lungs. Then we have respiratory infections. Obviously, we can't not mention influenza, of course more commonly known as flu, caused by the influenza virus. Tuberculosis, again a very well-known contagious infectious disease, mostly affecting the lungs, caused by tubercle bacillus or Mycobacterium tuberculosis. Get its name from the bacterial nodules or lumps which form in the lungs due to this condition. Then we have pneumonia, which is an infection of the lungs caused by a wide range of factors: bacteria, fungi, parasites, amoebae, and viruses such as the influenza virus. And of course, we have the chronic pulmonary diseases that we need to talk about. Asthma might just be the best known chronic disease of the airways. It periodically causes the airways to spasm and narrow, leaving the individual breathless, and the airways much more sensitive to various irritants. Emphysema is a chronic respiratory disease where the overinflation of alveoli causes weakened lung function. We also have pneumoconiosis, an umbrella term generally describing occupational diseases caused by chronic inhalation of particles. The diseases can be specified by the type of particle inhaled. Some are pretty obvious, such as asbestosis or silicosis. Others are not so easy to figure out, like anthracosis, which is a disease caused by inhalation of coal dust. Probably know it as miner's lung. Now to finish up, let's have a quick round of some respiratory system abbreviations. COPD is chronic obstructive pulmonary disease. We have URTI, stands for upper respiratory tract infection. ARDS is acute respiratory distress syndrome. And finally, you might see CXR on the medical charts. It stands for chest X-ray. And that wraps up this video on the terminology of the respiratory system. Hope you didn't get too out of breath trying to keep up. And before we finish up, here's a little challenge for you. Try to figure out what these terms might mean